I want to talk to you for a minute about a new project that we're taking a very serious, hard look at. Because of our experience in type 2 diabetes medication litigation, going all the way back to Resolin, we've always had a significant interest when companies launch a new drug that is supposed to be better than the last drug was to treat type 2 diabetes. Going back forever, treatment for type 2 diabetes, basically, that's the non-insulin dependent form of diabetes, typically was controlled by a drug called metformin, which is proven to be very, very, very safe, diet and exercise. Well, we know human beings. They're not real fond of controlling their diet or their exercise, and metformin alone sometimes is not enough to control patients' type 2 diabetes. You got to put all three together. So companies have worked real hard to come up with a magic drug so you don't have to really pay attention to your diet, you don't have to really pay attention to your exercise, and you can just take the magic drug and it'll fix your diabetes. Going all the way back to Resolin, which was the first groovy new drug that was designed to treat type 2 diabetes, we found that when you took Resolin, you ended up with liver failure. So it was bad for people. So then the newest drug came out on the heels of Resolin, touting itself as being better than Resolin without all those risks. It was called Avandia. Pretty soon they figured out that Avandia increased a patient's risk of having coronary artery disease, heart attacks, congestive heart failure, and problems like that. And so the next thing you know, Avandia kind of goes away, and on the heels of Avandia came Actos. Actos was just exactly like Avandia. Actos marketed itself as being the new, better drug to treat type 2 diabetes that didn't have all the risks that Avandia and Resolin had. Well, pretty soon reports and studies started showing that people who took Actos had a significantly increased risk of developing bladder cancer from their Actos. So third drug, third problem, serious health problem as a result of taking this simpler, easier drug. On the heels of Actos, we've got Byetta and Januvia that came out. Again, identical marketing scheme, better than Actos, better than Avandia, better than Resolin. And pretty soon, Januvia and Byetta have been linked to the development of thyroid cancers and pancreatic cancers. So, I don't know, for my dollar, I would rather work real hard at controlling my type 2 diabetes with diet, exercise, and metformin than expose myself to the risk of developing pancreatic cancer by taking the magic drug. Not long after that, we have Invokana that was launched. Invokana, another type 2 diabetes medicine. Invokana, ketoacidosis problems. Significant litigation over Invokana. And finally, Onglyza. Onglyza is a drug I really wanted to talk to you about. Again, another miracle drug, type 2 diabetes medicine. Just take a pill. You can remain, you can continue to eat poorly. You can continue to not exercise. You can just kind of be lazy and control your type 2 diabetes with this magic pill. The problem that is starting to be questioned about Onglyza is, does it cause congestive heart failure? There is evidence in a clinical study that was done on Onglyza where the control group was actually a group of diabetics on diabetic medication. And it was shown that Onglyza has a substantially higher incidence of causing congestive heart failure and death. Most people would say, wait a minute, diabetics, that's one of the things diabetics can have. They can have heart disease. Diabetes causes heart disease. Well, the important thing about the study that I just referenced, looking at Onglyza, is the control group was diabetics on diabetic medication. So you're comparing apples to apples there, and even comparing apples to apples, the Onglyza group had a significantly increased risk of developing congestive heart failure and the patients dying from that. So we've been involved in litigations going all the way back to Resolin. We've participated in every single one, and we fully anticipate if the science ultimately bears out that Onglyza has a significantly increased risk of causing congestive heart failure, we are going to be involved in this litigation as well.